cried my eyes out at work was when a beloved respite patient and friend of mine, who Susanna knows, died way too young of spinal cancer. I still remember him, and I reflect on how if we hadn't had medical respite services at the time, he would have died in excruciating pain on the floor of a shelter. But because of respite services, he was able to die on hospice in his own home. Medical respite saves lives, but it also allows people to die with dignity. On the flip side, and maybe it's just my stoic Scandinavian background, but there have only been a few times in my adult life where I've gotten so excited that I've literally jumped up and down. Once, when I found out I would get to be a mom. Another was when I found out that Catholic Charities, the organization I was working for at the time, was awarded a grant to fund a housing-based respite program. And those who have cobbled together funding for respite programs know how truly exciting this can be. I had previously helped develop a shelter-based respite program run by Hennepin County HCH, but I had hoped for a program where people could have their own private rooms and truly recuperate. I never would have imagined that that small Catholic Charities program would eventually merge with Hennepin County's program to become the Richard M. Schultz Recuperative Care Center, a respite program with 30 private rooms and a co-located HCH clinic that will open next month, as Susanna said. This partnership would not have been possible without the support and hard work of so many people, several of whom are in this room, including Susanna. I want to thank all of these dear friends and colleagues of mine who have spent their careers making these programs possible, and to those who will develop this new program into the future. It's truly a dream come true for me. To my husband, John, who helped write the grant that funded Hennepin County's first ever medical respite nurse, thank you. Little did you know that that nurse would become your future wife. Lastly, I am so thankful for all of the friends I have made through the National Council. For those of you who are new to this community and new to this conference, these are your people. They will become your lifelong friends and will help get you through hard days. This award is deeply meaningful to me, since I had the honor of serving on the RC Camp Steering Committee with Willie Mackey. Willie had a beautiful and humble soul, and he always had a hug, story, and smile to share. He was and still is an inspiration to all of us. He pointed us towards humanity, compassion, kindness, and a world where everyone is worthy of a dignified place to heal and a home of their own. Thank you, Willie.
I've been here since 2005. So, I don't know. You know, I just do the work. I got introduced to the work through Cincinnati Health Network in 2005. They said, come on, we're going to take you to a conference. Okay. And then I met Cowboy in 2005 and 2007, and he said, what are you doing here? I said, oh, I work for CHN. No, you're a consumer. You belong over here. And that's where I've been ever since. So we're talking about at least 18 and 20 years in doing this work. I love it. I love the work. I have met so many people in the last few days with lived experience. And this is what this is about. It's about those with lived experiences. My job is to pass the baton. I don't want to do the work till the day I die, but I'm looking for some younger people I can pass the baton to. So if you're one of those young people that want to get involved with the work, here you go. Reach out. It's so much work that we could do. So I'm not going to go on and on. And I have to say this. I have to thank Boston Healthcare for the Homeless. They have made me a family member. Thank you, Bill McConnell. Thank you. Thank you all. Thank you.
I wasn't expecting to get this award or scholarship, and I wrote, I think, an 800-page essay. It was getting the cobwebs out of my brain to be at 3 a.m. in the morning trying to turn it in. But I thank the council for giving me this award for the first time. I'm surprised myself. I want to thank my initial stepping stone to my career at Positive Health Warrior 6 HIV at San Francisco General Hospital, if you're up there. And then transitioning to San Francisco Community Health Center, where I was able to bloom and expand my abilities and my passions, as well join to the street medicine team, which is somewhere over there as well. Yeah. And I want to thank my family who has put up with me coming late to dinner time and trying not to pass out on the dinner table. And lastly, I want to dedicate it to somebody who pushed me, even though she is not here anymore. She passed away a year ago of overdose of fentanyl. I want to dedicate it to Jasmine Malachi. And she pretty much pushed me to continue doing the work. And that is why I'm here at San Francisco Community Health Center and doing the street medicine team and the Hennepin District. All right, thank you.
Award from your peers, your admirers, from the board of directors of the National Healthcare for the Homeless Council. Thank you.
Seldom I use notes because somebody told me that I've never seen the microphone I don't like. So, however, thank you, Bobby, and thank you to the Board of Directors of the National Council for recognizing me. And I must say, I couldn't agree more with what Bobby said regarding who gives you the award. To be so honored by my peers. People that I have worked with for 31 years. My first council meeting was I joined Healthcare for the Homeless in 1990, and I think the following Saturday we had a retreat. And ever since, this council is so important to me. I was talking to my wife this morning and she said, why don't you get Unity to break off the homeless program and you run it? No, I just retired. I'm not going back, I can tell you that. But I want to say with all sincerity that this is not about me. This is about the 1,000 employees that Unity has, and I'd like my team over here if they would stand up so you could recognize them. And we have also joined today by Dina and Marie. Dina works with the Department of Human Services in DC and was very instrumental, and Marie, who actually worked with the mental health organization, BMI, to bring together that partnership that saved the lives of many, many people in DC for the last 26 months. And to be recognized to receive this award from under Dr. Brichter's name, truly he was a pilot. He was a pioneer to pilot this program, bring it to where it is. I feel like I stand on the shoulders of great leaders who have gone before me. I think of John Logier. I think of Jim O'Connor. I think of Cowboy, as was mentioned earlier. I think especially of Dr. Janelle Getches. Dr. Janelle Getches founded Healthcare for the Homeless, and she was the one that decided we would not do work just on the street, that we would go into where the people are, because that's how we give them access to care. And she has worked for over 35 years and still continues in her role as emeritus to do that. She has worked in the jail. She has worked in every component of Unity. And I can tell you without doubt, her running at Christ House, kind of one of the first respite cares with Jim O'Connell and us in DC, has done an amazing job. And there are people in DC, and she doesn't particularly like it, who refer to her as Mother Teresa. And really. And I also want to say that John Lewis, who died a few years ago, talks about the beloved community. And he wanted the civil rights movement to create this beloved community, which is really based on the Gospel of St. John. And he talked about that and the need for nonviolence. He talked about that as the need for everyone to see each other as brothers and sisters. And I can say that the council has been a beloved community because it has really nurtured leaders, it has nurtured each other. And I am so grateful for 31 years of being part of that beloved community. He's also the one that told us to cause trouble. And he said, let it be good trouble. And you are the ones that are causing that trouble because you're disrupting a system that has failed so many people. You are the ones that see the need for equality and for racial equity as essential. But also the thousands of people that work for you that are beyond these rooms and don't always get to come to this conference. They are essential workers. Now, we heard during COVID about the difference between essential workers and non-essential in healthcare. There should be no such thing. We're all essential. And the people out there doing this work, yourselves and those you're inspiring to do it, are essential workers. And I would like to say, not just during COVID, but every day they go into those clinics. We had many people working hybrid, but you weren't working hybrid. You were there. We had a woman on our staff, I don't think she worked directly in the homeless program. She used to wear a badge that says, I'm an essential worker. One morning she was going to work and her spouse, because she had compromised health, and he said, you shouldn't really go. And she said, I need to go, I'm an essential worker. 1 month later, she died of COVID. And we saw in that generosity, not just her life, but the life of thousands of our fellow men and women who care for the most vulnerable in our society. So I would encourage you, I'm retired now, right? But at the same time, this unity is in my heart. And I would encourage you to keep causing good trouble. I want to say that we started out as Healthcare for the Homeless, as Bobby said, in 1985. I joined in 1990. We have expanded, we've changed our name, but we have not changed our mission. And as long as we have people over here at this table, and you have many others, we will never forget our mission, which is indeed to transform the lives of the people we serve. Give them dignity, both living and when they're dying. Before I leave, I just want to say there would be many, many more people standing up if Kevin Lindemood didn't steal all my good stuff. So on that note, thank you very much.
So now we know what else happens at our conferences. Wow, thank you all so much. It's just been so inspiring to hear of those who are not have just gone before us, but those that are still in our midst. Those that are still doing the work as we are still doing the work. And it just strengthens us to see what we are doing and helps us all just move forward. So I just want to close just by asking you to give a rousing round of applause for all of our award winners, to Jesse Gaeta, to Petroskas, Valarie Dowell, and Vincent Keane.